series of 4 that we offer during the UNICEF IAP e-learning course on the foundations of disability inclusive education sector planning. It's now 2 o'clock here in Paris. My name is Jennifer Pai, and first of all, I wanted to apologize for the issues that we've been having with scheduling this event. So apologies for those who've been waiting. We're now on. We have Elizabeth with us, so that's great. So as was the case for the last webinars, we have technical staff from ministries of education from 8 countries from South Asia attending. And as I was saying, I'm delighted to have Lisbeth Wolving join us today from Sightsavers, an international NGO with headquarters in the United Kingdom. Sightsavers works in the area of sight protection and disability rights with a focus on low and middle income countries. Let me briefly introduce Lisbeth. Lisbeth is the global technical lead on inclusive education systems at Sightsavers. She has 25 years of experience working in education in the development and management of complex education programs and projects in various countries in Europe, Asia, South America, and the Caribbean. She's worked for international organizations such as UNICEF, the World Bank, UNESCO, World Education, and Voluntary Service overseas. Her areas of expertise include rights and evidence-based programming, participatory leadership and project management, capacity building and empowerment, access and quality of basic education, and decentralization. Liz will be presenting today on school-based vision screening, a case study from Cambodia. Let's do some housekeeping before handing over the mic to Liz. The webinar will last for 1 hour, and Lisbeth will be presenting for about 30 minutes. Some questions have already been asked, and we're hoping to have a lot more questions come through the platform as Liz is presenting. Please place them in the question and answer section. For this webinar, we are using Zoom and YouTube Live. If you do experience any technical issues throughout the live session, please don't hesitate to reach out to us. Sage is there to respond to your queries. Just send a message to Plan for Inclusion email. This webinar will be recorded and will be available shortly after this live session. As I said, you can ask your questions and make comments on the chat in the menu bar on the bottom of your Zoom window. And for YouTube, you need to be logged into your Google account in order to post in the chat to the right-hand side of the screen. We will be collecting questions throughout and look forward to an animated discussion. So let's hand over the mic to Liz. Liz, the floor is yours.
Thank you very much, Jennifer, for this very nice introduction. And good afternoon or good evening, everyone. I'm very excited to be part of the course, and I look forward to an hour of sharing with you about my experiences with school-based vision screening in Cambodia, as well as just having a dialogue at the end about how to implement vision screening programs in schools and more broader disability inclusive sector planning. So I'll set up my screen and share my presentation with you. Let me see if I get it all right. Just need to get my notes up and ensure that the subtitles are, sorry, that's not the way I had it in mind. So I hope that the live captions are on as well. I'm not seeing that. Yeah, I'm seeing that appear on my screen too.
There.
So we're all set. We just have to go to the first page. So as Jennifer already said, I'm working at Sightsavers, and we do programs in 33 countries in the world. And we are based, our headquarters is based in the UK, in Brighton, and I'm doing this webinar from Brighton. It's near the seaside, so you may hear some seagulls in the background because we have many of those, so they might fly by and say hello. they're often quite lively. So if you hear birds in the background, those are the seagulls from Brighton. I'm looking forward to this session for various reasons. I think it's very interesting to have so many different perspectives in the group today. Obviously, 8 countries in South Asia with very different characteristics. So I'm looking forward to a lively discussion at the end of my presentation. As you have seen already in the introduction video, as well as the announcements of Bob Prouty with the outline of Module 3, I will be sharing a case study from Cambodia, and just to illustrate and walk you through the process of how a pilot project can be scaled up and become like a national program. And I think there are many elements within that case study from Cambodia that we could all benefit from in terms of what worked, but also what didn't work so well. So I think it's good to share that with you, as all countries are now really having a commitment to deliver on SDG 4 and how to make sector planning more inclusive. So this may help us to point out some things that you can also take forward into your countries to discuss sector planning and making the response more disability inclusive. So talking about the experiences in Cambodia, I think you've already have an idea of what we have done there through the introduction video that you watched in preparation of this session. I hope that you have seen that, but I'll share with you what we did in Cambodia with the vision screening program, and also how it led then to scale up within Cambodia, but also to 3 more countries in Africa. At that time was Ethiopia, Ghana, and Senegal, and it has later also expanded even more. The same approach was, for example, implemented in Pakistan to use schools as a platform for eye health screenings through their school health integrated programming, the SHIP initiative in Pakistan. So this started in 2012 in Cambodia, but it has had an expansion in different continents. So I'm happy to share with you a little bit more about what we've done. And if we look at the importance of identification and screening for disability inclusive education, a lot of has been discussed already in the sessions that you've had, particularly in module 2. If we look at the World Report on Disability, it states that about 1 billion people in the world are living with a disability, and at least 1 out of 10 are children. And about 80% of them live in lower middle income countries. So it has been estimated that about 1 out of 3 out of school children have a disability. And in many countries, there is insufficient knowledge on inclusive education and how children with disabilities can be effectively included in the education sector planning and in schools. So many children with disabilities remain invisible and excluded, and this is largely due to insufficient data. So once more, specific data is available, the education system as a whole and the school in particular can then take targeted measures to address the different needs to ensure that every child can learn and no child is left behind. Well, you have discussed this obviously in great deal in module 2 with Dan and Natasha. And I think that we can all agree that disability disaggregated data collection is essential for effective disability inclusive sector planning. You also identified earlier on in module 3 what strategies, approaches, and tools are available to improve and strengthen systems. So in this session, I would like to share an experience from Cambodia and describe the process of implementing school-based vision screening from the pilot to the scale-up. So the main focus is basically in this presentation on visual impairment and on eye health. And you probably have the question, why is vision screening so important when we talk about inclusive education and disability? Well, basically, visual impairment is one of the most common disabilities and impairments in children, but many cases can simply be corrected with a pair of eyeglasses. So children with visual impairment and functional difficulty with their vision, who lack the access to vision correction, are often at a disadvantage in terms of school enrollment, educational attainment, and also obviously learning. So if we look at the classroom level, it is estimated that about 80% of the information is shared in visual form. And approximately 60% of children with learning difficulties have an undetected vision problem. So these figures indicate that students' vision is very important for the learning process. If a student happens to have poor vision that is undetected or uncorrected, then the risk of falling behind and eventually dropping out increases significantly. So that is why we focus on vision screening as an entry point to increase disability inclusive responses in the education sector. And to illustrate the importance of vision, the picture is of Svrij Liep, and she studies now in grade 11. She struggles in primary school due to her poor eyesight, which remained undetected until grade 6. So her participation and results improved significantly when she got a pair of glasses and could see the blackboard a lot better. And it's a very simple, straightforward solution and intervention, but it makes all of the difference if you have clear eyesight, right? I mean, some of you may wear glasses or struggle sometimes with sight and with vision. You know that things take a lot more effort, are more difficult and more frustrating if you can't see clearly. So this was one of the reasons why we focus in Cambodia on vision screening. So what was the challenge and what were the strategic decisions that we made? So first of all, why did the Ministry of Education in Cambodia chose vision screening as an entry point for disability inclusion? Well, looking back at the history, in 2010, the Ministry of Education conducted a disability prevalence study, at that time with support from Humanity and Inclusion, the former Handicap International, to basically identify reasons why children are out of school, and also to identify possible interventions to include or reintegrate these children into the education system. And one of the key findings of this study indicated that many children who dropped out of school or never enrolled had health issues. And if we looked at the specific issues that they had, many of them were related to visual and hearing problems. So it was expected, based on these outcomes, that there would be students enrolled in school with undetected functional difficulties, which could then impact successful participation, obviously, and increase the risk of dropping out. So the challenge was how to identify these students, acknowledging the complexity of the problem. But since the prevalence study showed that there were often issues with vision and hearing, the Ministry of Education decided to break it up and focus on students with visual impairments first. And there was various reasons for it, but they felt confident that they could take that on as a first step. So if we then look at the criteria of affordability, feasibility, and desirability, the rationale for this decision was as follows. Reflecting on the required resources to conduct vision and hearing screenings in schools, vision screening seemed one of the easier problems to address, and also relatively low cost, which is also obviously an important criteria. This would generate quick wins, the so-called low-hanging fruits, and that create early visibility and success. And this would then help and encourage the Ministry of Education to expand disability inclusive interventions of a more complex nature, because these require more time and more comprehensive institutional capacity development. So there were partner organizations in country who could provide the necessary technical support in the area of visual impairment, which was more difficult to find in the area of hearing impairment. And it also turned out that screening for hearing impairment was more resource intensive and more expensive. More comprehensive equipment was required. So again, it was decided to focus on vision screening first. In addition, the cost of a pair of glasses, for example, would be much lower than the cost of a hearing aid, and glasses would be easier available in different parts of the country. This again is not a justification for not paying attention to children with hearing issues, but it was just we had to start somewhere, and the Ministry of Education felt that they could take this on while they had to prepare a lot more in order to deliver on hearing screening. So it was quite easy to get the buy-in and the support at the various levels in the system because of the clear connection between vision and students' participation and achievement in school. Investing in vision screening is something everybody can quite relate to, and from own experiences, knowing how important vision is. So investing in vision screening led also to contributing to reducing repetition and dropout, and that connection was quite easily made. And that was at that point one of the key priorities for the Ministry of Education. So it was easy to justify investment in vision screening would actually lead to a reduction in repetition and dropout for students who were identified with functional difficulties. So in terms of looking at sustainability, there are basically three main aspects that we considered. First was the implementation capacity of the Ministry of Education, which obviously is critical for success. So this relates to planning and coordination, but also to the capacity of teachers and whether they are able to take on this extra task in addition to their already quite full workload. So we will discuss this in more detail later, because the pilot was developed to answer this question. The question being, can teachers be used to do basic vision screening? And once teachers learn how to conduct basic vision screening and what adaptations can be made in the classroom to accommodate the specific needs of students with visual impairments, it is expected that they continue to use this skill also when the project is completed. So that investment in building the capacity of teachers is then something that is given to the system and will be used and doesn't need to be repeated on a very regular basis, which makes this a cost-effective intervention. Secondly, in terms of sustainability, there is obviously an important aspect, and that is the coordination between the Ministry of Education and the Ministry of Health. Because if we talk about school health, obviously we need to have good collaboration with health service providers to ensure that there is follow-up support from professionals who are specifically trained in providing more in-depth screening and assessments. So it is critical that there is a good coordination between Ministry of Health and the Ministry of Education. Teachers can obviously conduct the initial screening, but the Ministry of Health will need to provide specific eye health practitioners to support the detailed eye examination and prescriptions and the provision of glasses where needed. So that's a very important element of it. And then in terms of costing, for new approaches and activities to be integrated in regular plans and programs, it needs to be affordable for a government, and therefore cost implications are a very critical aspect of sustainability, right? It always is, no matter how effective it is, costing is always an issue. If it's really high cost, then it's often challenging to get funding to continue an initiative like that. So that is about sustainability. Then how did we approach it? What was our initial thinking about how to approach a vision screening program and how to set it up in schools? We basically developed a model for school-based vision screening in schools through a participatory approach. And we very much put an emphasis on the importance of participation at the different levels in the system. The first step in the preparations was to conduct a series of stakeholder meetings with the Ministry of Education at the central, but also the provincial, district, and school level, as well as with the stakeholders in the health sector. As I said before, the collaboration is very important, and in the donor and the NGO and CSO community. So that was just to open the dialogue and to start engaging the different stakeholders at the different levels in the initiative. And the second step was then to prepare the training program for teachers, the development of guidelines and forms and materials that were needed for the vision screening. So this included a vision screening kit and a protocol for the follow-up screening by the refractionists, and we decided to set up a mobile refraction team that would go and rotate and go visit different schools to do follow-up assessments with the students that were identified by the teachers. It's very important that there is a clear mechanism for professional follow-up of students who have difficulty with the basic screening carried out by the teacher, because obviously this pilot has provided evidence that teachers can do the basic screening, but specific expertise is then needed to further assess the child's vision and any other necessary actions that are required to help the child with their vision issues. So it's important to have that outlined and to ensure that it doesn't stop with the basic screening of the teachers. There needs to be a system in place that referrals can be made. And the third step was to conduct the teacher training, obviously a very critical and main intervention throughout the approach. So this was provided by the Ministry of Education, but was in partnership with a technical team of NGO partners with specific expertise in the area of eye health, as well as the Ministry of Health. So the training consisted of a general session on eye health, followed by a detailed session on how to conduct the vision screening. And a lot of time was allocated for practicing on each other to build up the confidence to do that basic screening. And we estimated, or we explored, and this requires a minimum of 1 day to do that well and to give the teachers the confidence to do this independently in their own schools. The final part of the training then was used to discuss the planning for implementation, so doing more the operational side of things, and how to prepare at the school level for this basic vision screening. We decided to add a session on inclusive education because we felt while we have the teachers there and all the stakeholders, it would be good to use this as a platform and explain a little bit more about the basics of inclusive education and what teachers can do to accommodate children with visual impairments in their classroom. And other health interventions such as deworming can also be added to the training to increase the cost effectiveness and time efficiency. So once teachers come together to be trained on vision screening, it's something good to consider if it is wise to add other topics to improve school health programming. So then following that basis, the first step of the approach was that the teachers would conduct a vision screening in the school. So teachers were trained, they were all going back to their schools and conduct the vision screening with the students in their school. We decided to screen all the children in the schools, and so the teachers screened all students to identify which students may have problems with their eyesight. And there were basically two possible outcomes. The child has no problem with the test, so then obviously there is no follow-up required, or the child has a difficulty with the test. And in that case, if they had difficulties with the test, somehow they received a specific letter from the teacher to be seen and assessed by the refraction team. And in this case, in Cambodia, this team would follow up visits in the schools so that the children would not go to any other place, they would just be seen in their own school. And the second step was then for the visit of the mobile refraction team. So once the students who had issues with their vision were identified by the teacher, there was a schedule put in place where the mobile refraction team would come to visit the school. The students with the referral letter then received an in-depth eye examination from trained eye health professionals. And based on this assessment, there were basically three possible outcomes. So the first outcome would be that the child had good vision and therefore there was no need for a follow-up. Sometimes teachers weren't really sure, so they gave a referral, but with retesting, it showed that the child had good vision and didn't need any follow-up. The second outcome could be that the child had refractive error and that issue could be corrected with glasses. In that case, we would provide glasses on the spot. We had glasses with us and different lenses as well. So most children would then receive a pair of glasses to correct their vision on the spot. In certain cases, we had to order them if there were really specific lenses required, but most could receive them in the same day. And then the last outcome, the third option, would be that children would have vision difficulties that could not be corrected with glasses and needed more specialized follow-up support. In that case, the children would receive another referral letter with a suggestion for a health service provider that could then follow up with them to see what else was required. So the final step of the implementation was the follow-up visit. And I think this is very important to highlight. Once children receive support, that we need to make sure that there is a continuous follow-up support system where children who have glasses or other issues get regular follow-up support to monitor if their condition is changing, whether there is an issue with compliance, or any other questions and concerns that the student or their parents or their teachers may have. So it's important to have that support network in place, and that students are monitored after receiving the support that they needed. Reflecting on the implementation then, the main question was why we did this pilot was, are the teachers actually able to conduct vision screening in schools? Initially, many teachers who participated in the training felt insecure about testing children's vision. They were like, well, we're not really professional in that area, so we're not sure if we can actually do that. So it's very important to build in that practice time during training so that they can build up the confidence. But once they had received that support and did it a few times, their confidence grew quite quickly. And the feedback that we then received was that it was actually quite easy to do once you understand the system, and it actually goes quite fast. And they enjoyed doing it. So we also did a random retesting to assess whether the assessments made by the teachers were accurate. And with that retesting, we actually found that the accuracy was really high. And this showed also the evidence that teachers are able to do this basic vision screening with the right training and the right support and the right materials. So I can imagine that many of you may wonder and may have concerns about how time-consuming this is, because teachers' main task is obviously teaching, and giving them an extra task to do health screening, would that then be too much for them? Or is this something that is realistic to expect from a teacher? So our experience is in the different programs that we have done to date, is that it actually, once they establish a routine, they can test up to 100, 150 students in a day. And it takes only about 2 minutes per student. So it shouldn't add too much time to their already obviously heavy workload, and they should be able to integrate it quite easily. And it's always been something I bring up in discussions with ministries of health in particular. It's like the core responsibility from a teacher is to teach. So they can take on extra additional tasks to support students and to help them learn better, but it needs to be manageable, and it needs to fit into their timetable, and it needs to be realistic. If that's not the case, we need to think of other ways to bring in people to do that. About the mobile refraction team, I think it's important to mention that in Cambodia, there were fortunately enough qualified refractionists. So we were able to set up the mobile teams to visit the schools. This was basically to avoid that students had to travel to the different locations for follow-up examinations, because that is obviously a risk and sometimes a barrier. But we are very aware that this is not always feasible. So therefore, other scenarios should also be considered depending on the country-specific context. So if there are not enough refractionists, what other systems can be established to ensure that there is a referral network where children can receive services they need. So this slide is just basically to illustrate the screening process I just described. It's just like a visual presentation is often helpful for, picturing how that process actually goes. So to guide the ministries of education on how to set up vision screening programs, we developed 2 manuals. And you are probably familiar with these manuals because, or you should be, because they were listed as the compulsory reading for this session. One of the manuals is focused on the training aspects, the technical aspects of vision screening programs in schools. And the other manual is like a complementary manual with guidance on the operational aspects of setting up vision screening programs. So I think both are useful reference documents if you consider school health programming in your countries. So I would recommend to download them and keep them as a reference. The manuals were shared in your information, but they can also be downloaded from the website of the Global Partnership for Education, and they are available both in English and in French. So if we then look at partnerships, because I think it's quite critical to discuss partnerships as they are essential for successful implementation in my experience. We've probably all heard about the expression, it takes a village to raise a child. So this means that it takes an entire community of different people interacting with children in order for these children to experience and grow in a safe environment. In the case of the Eyeglass project in Cambodia, a lot of time was invested in building a supportive environment and making an effort to engage a wide variety of stakeholders in that process. Because the more people support it, the more easy it is to get the buy-in and to get the support from everybody, and that's needed for the success. So first of all, in the case of Cambodia, we had a very fortunate situation that there was strong political will and commitment from the Ministry of Education. This included the decentralized governance at the provincial and district level, but also various departments within the Ministry of Education, such as the Department of Primary Education, the Department of Secondary Education, the School Health Department, Department for Special Education, the Department of Planning, and the Department of Finance. So we had all these different departments mobilized and they supported the initiative. At the school level, obviously support is needed from the school director, but also the school-based management committees or the school support committees, the parent-teacher associations, and obviously the teachers. I mentioned the teachers in the graphic separately because I think they play a critical role, because they will have to conduct the basic vision screening, but they also provide support to those students who have visual impairments in their classroom. So they need to encourage the students wear the glasses, but also to how to look after them properly, to monitor compliance, and also to monitor if the situation changes and they might have new issues occurring or they might need corrections. So they play an essential role. If we look at the community level, the project involved key stakeholders from the community, such as the village leaders, people in Cambodia, Buddhist country, monks were involved to help out to reach parents and promote the initiative and also discuss any questions or concerns they may have. And that has a lot to do with obviously belief systems and the ideas that they have about wearing glasses, for example. So it was important to engage them in that dialogue. Then obviously an important partner is for specific technical expertise, working together with international and national NGOs with expertise on eye health. Because I think the Ministry of Education does not necessarily have that expertise in-house. So it's important to build those partnerships with experts that can support initiatives in this area. In Cambodia, that was Sight Savers who was involved there, but also the Fred Hollows Foundation, because they had an office there and Sight Savers didn't. So we worked together with Fred Hollows Foundation, and there was a local NGO called Krusate Mai, because they had expertise in guiding people with severe visual impairment and blind students. They had schools for the blind and for the deaf. So that was an obvious important partner for us to speak on their behalf. And also we work together with Essilor Foundation, and Essilor is the provider of glasses worldwide. And their foundation actually provided glasses for free to support this initiative. So that's an example of private partnerships and private sector engagement that can also help to reduce the burden on finances for the Ministry of Education. Then if we look at the mobile refraction teams, I explained the importance of a support network with professionals who can do the follow-up support. Mobile refraction teams went out to the schools to do the essential follow-up screenings after the students were screened by the teachers. And they were also tasked with the provision of glasses or referrals to specialized eye healthcare services. And this is really essential because this, as I said before, this requires a certain expertise that teachers do not have. And therefore the partnership with the country's pool of trained refractionists was established and is essential for doing vision screening programs like this. Then obviously close collaboration with the Ministry of Health and eye hospitals and other eye health service providers at national and local level is necessary. This is to ensure that follow-up support is available and that the links between the two ministries of education and health are established. MOH and health service providers can also advise Ministry of Education on procurement of glasses and assistive devices and any other equipment that might be needed. So again, a reason why that collaboration is important. And last but not least, I think it's important to mention the support from donors such as the Global Partnership and the World Bank, who supported this initiative. And they allowed us to try out the new innovative way to address inclusion at school level by training teachers to conduct that basic vision screening. And this provided us with important learnings on what works and what doesn't work. And obviously donors such as the Global Partnership for Education, the World Bank, but also UNICEF, UNESCO, everybody has such a strong focus now on disability inclusion. There's a lot of expertise available, but also the climate is there to get real support for any sector plans that have a good, solid inclusion component. So I think in that sense, the time is right for us to get this on the agenda and to get the support in the different countries to do this in a more comprehensive way. So this slide basically illustrates that although the school offers the screening, close collaboration and partnerships with a wide group of stakeholders is actually needed to support the learner in the best way possible. It's a joint effort to ensure that the right support is provided at all stages of the process. And basically we all the partners in that graph or in that illustration have a commitment to SDG 4 and to ensure that all children can learn. So it's a wide group of stakeholders to mobilize. Then looking at the learnings, what are the learnings and the most important lessons I'd like to share with you today? Basically, many pilot projects to test these innovations are often managed by the international NGOs, who then work closely with government partners to implement the project and assess effectiveness, right? It's often still quite INGO driven. But in this project, we changed that around and we adopted a different mechanism where the Ministry of Education was given the opportunity to lead. And this was basically with the intention to increase their ownership and accountability. So the Ministry of Education received and managed the project funds directly and contracted the INGO partner for technical assistance in the field of eye health. So this changed the traditional way government and NGOs work together. And it was interesting to use this model because it was initially more time consuming because we had to set up, obviously mechanisms to manage this transparently within the ministry. But it was definitely a good investment in time and effort to set up systems because it resulted in a very strong ownership from the Ministry of Education throughout the entire project cycle. And the added advantage of this model was because the project funds were disbursed to the Ministry of Education, the Department of Finance was accountable for managing the contract. And that obviously the budget from the project was added to the overall budget of the ministry. So this meant that there was a strong internal accountability as well. And that obviously led to increased commitment and involvement from the government. And that helped with scaling up discussions. So if we then look at the participation at the decentralized levels, at the provincial and districts, and also at the community level, this led to very strong support on the ground, and it has been very critical for the positive project outcomes. Investing in the education support networks involving all the stakeholders, basically by assigning specific tasks to them at their own levels, has proven to be a very successful approach for creating strong ownership at all levels. And that's not for only the vision screening, I think that counts for all programs that we do. So as I said in the beginning, we promoted a participatory approach, and through that approach, the project promoted a better understanding about eye health and inclusive education, not only among teachers, but also students, their parents, and community members. So by providing that basic one-day training, teachers gain skills to effectively screen students using vision screening kits that they received. And as I said before, to check the quality of the testing that the teachers did, we did retest them, random retesting, which shows that there was a high accuracy. So that is the evidence we wanted to get about could teachers do this screening or not. It needs to be acknowledged that teacher training alone is not enough. It is equally important that there is a follow-up from trained refractionists to ensure that there are accurate prescriptions and referrals made. Over and under correcting can obviously be very damaging to young people, and therefore the importance of collaborating with qualified eye health professionals needs to be emphasized. I think that's very important to highlight once more. Regarding prevalence of refractive error and a target group identification, Cambodia decided to include all grades of primary school, grade 1 to 6, in order to identify if the younger age groups should be included in future programming. And apologies. Results show that even though the prevalence is low in the rural areas of Cambodia, early detection is indeed important and justifies starting screening in the lower grades. However, it also needs to be mentioned that inclusion of secondary schools should be considered, as the prevalence of refractive error typically occurs around the age of secondary education students, end of primary, early secondary. So it needs to be considered to include secondary education as well. It is recommended that the timing of the project is aligned with the academic year and the school calendar. This is to allow the teachers to follow up with the individual students from the beginning of the year. And this allows them to support and enhance their learning achievements throughout the year. So ideally, the training should be conducted at the beginning of the year to prepare for implementation of interventions at different times during the year. For example, the vision screening could be done in the first semester with a possible follow-up in the second semester. So then the children benefit from the support that they receive throughout the whole academic year. During our pilot, it was not very well aligned. So we were doing the first round of training and the vision screening at the end of the school year, which was not ideal. So it's recommended that the timeline is more in line with the academic year. And finally, one of the last learnings I would like to share is that there was an unexpected finding, which was not included in the original design. And that was the high occurrence of refractive error among school personnel. And that learned us that in future screening programs in schools, it is important to explore this issue in more detail and consider if there is an opportunity to add a component to support teachers and school staff with their vision needs. Good vision is obviously essential for quality teaching, and therefore these observed needs must be considered in the context of education quality improvement. Because if teachers struggle with their eyesight, their work obviously can also be impacted. So we did include teachers and we allowed them to do screening when possible, and that was very well received. And it had an additional advantage that when teachers were given glasses, they obviously become role models for the students too. If the teacher wears glasses, then the child will feel a little bit less awkward if they have to wear glasses too. So it had different effects, and it all supported to create a supportive environment for the students not to feel uncomfortable or embarrassed by needing glasses. So that was a very interesting additional finding that we discovered. If we look at the outcomes of the pilot project, we see a very interesting spin-off, and I'd like to share that in a little bit more detail with you. The direct results of the project are marked in orange, but the project also contributed to many other initiatives indirect to support inclusive education, which are marked in blue. So the main outcome of the pilot is that it demonstrated that teachers are capable to conduct the basic vision screening when they get the right training and also the right support. Based on these encouraging outcomes of the pilot, the Ministry of Education in Cambodia included vision screening into the new ESP that they prepared, with implementation in 3 provinces. So that was a geographical expansion. And a little later, the GPE and the World Bank committed to additional funding for geographical expansion of the project within Cambodia, as well as also 3 new countries in Ethiopia, Ghana, and Senegal. And this allowed for more in-depth knowledge and evidence generation. So this included, for example, a cost effectiveness study and the development of a costing tool for ministries of education to support the planning and budgeting of different implementation scenarios. The project also supported the dissemination of learnings, and the Ministry of Education shared the experiences with school-based vision screening and school health programs in regional and global events. So that was an important spin-off as well. Then the Ministry of Education undertook several actions to strengthen the enabling environment, which we have talked about obviously a lot in the course already, how important the enabling environment is. So the Ministry of Education and the technical eye health partners established national visual acuity guidelines, and these were used to guide any vision screening efforts in the country, basically, to have a standardized guideline for it. And in addition to that, there was vision screening modules added to the pre-service teacher training curriculum, so that newly trained teachers already have the necessary skills when they take up their teaching jobs. So this will reduce the need for in-service teacher training in the future. So that's a measure of sustainability, obviously. In addition, school health and inclusive education policies were updated, and newly established policies were initiated where needed. So the policy environment improved, and it was a measure also to support implementation of the existing policies and allow the ministry to address those effectively. So during project implementation, the discussions around inclusive education gained more momentum, and it became one of the ministry's priority areas. Several new initiatives for inclusive education have been introduced. Since the pilot, the Ministry of Education has, for example, developed several policies and action plans to address inclusion better. There is a new revised inclusive education policy, but also an implementation framework. And the Ministry of Education recently established an independent department for special education, as well as a National Institute for Special Education for teacher training. And that is a clear confirmation that there is a commitment to inclusive education in the years to come. The Ministry of Education also made an agreement with Krusata Mai, the local NGO I mentioned earlier. They set up and managed several schools for visual and hearing impaired children in Cambodia since the early 90s. And the Ministry of Education is now in the process of taking these schools from the local NGO and take them over as government schools under direct management of the Ministry of Education. So these are all great steps forward in addressing inclusion in a more holistic, systematic way. So basically, this slide I wanted to use to illustrate that even if you plant a very small seed at the right time, which the eyeglass project was in 2012, it can cause a ripple effect that then may lead to long-term sustainable impact. And that is what we still see today. So that is exciting. I'd like to recap a little bit at the project planning and implementation process. As I mentioned earlier, the challenge was that that we started with was how to identify children with visual impairment in school, right? So we want to identify these children so that they can get the necessary support to fully engage in the learning process and to improve the learning outcomes. So considering the affordability, feasibility, desirability, and sustainability, that is the focus also of this module, is the Ministry of Education decided to develop a school-based vision screening module to train teachers in conducting basic vision testing. The main purpose was to assess if teachers could take on this additional responsibility and identify what support systems are needed to provide the necessary medical follow-up and provision of glasses to ensure the needs of the students were met. So the results of the small pilot project were promising and provided initial evidence that this could be an effective way to identify children with poor vision in the classroom. This led to additional funding for an expansion within Cambodia, as well as 3 other countries, with the aim to refine the model and test it in different country contexts. There was a strong emphasis on documenting our learnings, which resulted in the development of various guidelines and manuals to support the implementation. And you have been shared these documents for use in your own countries. In addition, a costing study, I mentioned that before, was carried out to assess the cost effectiveness of the model, to inform the Ministry of Education about budget requirements for implementation and scale up. And I think that is quite critical as well. So in summary, if we then look at the experiences in Cambodia, I would like to review them against the inclusive education framework that was introduced to you in module 2. So if we start on the left at the supply side, there are the teachers. It is clear that they play a very critical role in the vision screening process, obviously, as they do the first basic assessment. And they are also responsible for possible adaptations in the area of infrastructure and learning materials, especially at the classroom level. For example, the teacher may want to make adjustments to student seating arrangements to assist a child with visual impairments. You might want to move the child to the front of the classroom, or you want to make sure that the child sits in an area with enough good light. In certain cases, there may need to be modifications in learning materials. For example, large print or the use of Braille. That is something that the teacher needs to facilitate. Adaptations may also need to be considered for curriculum and for student assessment tools, and the provision of extra additional learning support, such as eyeglasses or magnifiers or Braille machines. So this is all necessary to make sure that the testing is inclusive and fair for students with visual impairments. If we then move a little bit more to the right side of the framework, the demand side, it is very important to look into attitudes. We haven't really talked about it that much, but attitudes and belief systems are very important. We need to know how people feel about disabilities and visual impairment. An example is, do people actually believe in wearing glasses? Is it socially accepted, or would it be an issue? Would people be bullied for it? In the case of Cambodia, some stakeholders mentioned that they thought that wearing eyeglasses would make people's eyesight worse over time. And therefore they said it would be, should not be encouraged. We should not encourage children to wear glasses. They should just keep practicing their eyes. So it's very important that we had these discussions and that we created the consultations at different levels and orientations so that we could talk about these concerns and share these belief systems. Because if we don't know those underlying ideas and beliefs, then it might actually impact the project in a negative way without us knowing it. So I think it's important to look at attitudes and belief systems for any disability inclusive interventions that we do. And as mentioned earlier, when we worked with the adults, the teachers and community representatives, they indicated that they also struggled with their eyesight. So we offered them a free eye test during the project. And some of them were given a pair of free reading glasses. Because of that incentive, their support increased, and they also encouraged students to wear their glasses because they learned from first-hand experience how much easier life gets when you have improved vision and the impact of improved vision. So then looking at the cost aspects are obviously always an important issue when introducing new interventions. And that's the reason why we conducted a costing study to analyze the financial implications of a school-based vision screening program. And this provides valuable insights into the cost for scale-up and also for expansion for future sector planning discussions. The main benefit of the eyeglasses project is that it contributes to achieving the full academic potential of children, and that it helps contribute addressing the learning crisis that we face in schools. Learning outcomes need to be improved, and we can state that good vision supports the learning outcomes. So if children have issues with their vision, correcting that will help to deliver on SDG 4, right? So that's the main argument, obviously, for considering vision screening programs in school. So if we then look at the bottom, at the enabling environment, obviously very important too, as we can see in Cambodia, several supportive policies were in place to promote school health and inclusive education. And that is very necessary for successful implementation, but also for budget allocations. Obviously, if there's a good policy in place, obviously then there needs to be a good implementation framework as well. But that can help to prioritize certain issues. And I think inclusion is high on everybody's agenda right now. And it helps to advocate for budget allocations for specific disability inclusive interventions. Regarding data and evidence, I think we discussed that in great length in the previous module, in module 2, the importance of disability disaggregated data. Because if we don't know the situation, then we cannot put good measures in place to help these students. So prevalence of visual impairment is still low in Cambodia, but it's increasing in many countries. So doing basic vision screening in schools is a good way to ensure that children have access to these services, while they otherwise may not. So if we look at the level of leadership and management, the project received very strong support and commitment from the highest leadership level in the Ministry of Education. Both the Minister of Education and the Senior Secretary of State were actively engaged in the project, and that really helped to put this on the agenda. The project invested heavily in building strong partnerships with different partners and stakeholders at national and local level. So this resulted in very strong ownership at basically all levels in the system. And eventually this resulted in budget allocations for vision screening interventions in the education sector plan. So that's something we had hoped for, but was obviously, the pilot was a short project, so we couldn't expect that during the timeline of the project. But eventually, over the years, there is a resource allocation from the Ministry of Finance to do vision screening in schools as part of the ESP. And that's obviously the most sustainable way to approach it. So that was basically something we were hoping for, and luckily that materialized as well. So a number of key messages to share with you to take away. Obviously, the pilot project was in 2012. And a lot of things have evolved since then. There are several countries in Asia and Africa who have started implementing vision screening and eye health programs in school. I know we have participants from India. There's a lot of experience in India in school-based vision screening. Pakistan is doing vision screening. The SHIP program that the Eyeglass project led to is scaled up even after the funding we got from GPE into Pakistan as well. More than 1 million, I think, or maybe even more than 2 million students have been screened in Pakistan. So there is experience there, significant experience. And there is a lot going on in the area of school-based vision screening. So I wanted to share with you that the World Bank in the end of 2019 launched a paper called Looking Ahead, Visual Impairment and School Eye Health Programs. And this document basically captures the latest developments regarding school eye health programming and visual impairment. It's part of a series of notes on the price of exclusion, disability and education. So it's very relevant, I think, for the focus of this course. And the paper presents a multi-country analysis on effectiveness, costing, and critical success factors regarding school eye health programs. The document has a strong focus on sub-Saharan Africa, but there were also a number of Asian countries included in the study. This included Bangladesh, also Cambodia, Indonesia, and Vietnam. It also is interesting that it mentioned that in the last 40 years, myopia, that short-sightedness, the rates in East Asia have, for example, doubled, and in some countries even tripled. So you can imagine that this impacts learning outcomes and impacts student participation if it remains undetected, right? So that's another reason why we need to consider this in education as a critical issue. I would recommend you to read this document if you want to know more about the topic. The document is included in the optional reading materials for this session, so you can find that back. If not, Jennifer or I can help you get a copy. It's also available on the World Bank website for downloading, so it's easy to find. To close, I would like to share a few key messages from our project findings that are also confirmed in this paper so many years later, right? So it's interesting that it's reinforced after many studies in different countries. You can keep these messages in mind for future disability inclusive sector planning discussions in your countries. First of all, impact evaluations from various countries suggest that benefits from school eye health programs can be large, especially for improvements in participation and learning outcomes. And I think that's a very important one because obviously, as I said before, we are facing a learning crisis at the moment globally. So we need to come up with good solutions. A multi-country study indicates that school eye health programs are relatively cheap to administer. And again, this is obviously cost effectiveness is always a big issue in countries with limited resources and huge demands. So if this can be done in a cost-effective manner, it's easier to get the buy-in and to get the support and get the budget allocations for it. So it's a relatively cheap intervention. The third key message that I'd like to share is training for teachers to learn these basic vision screening skills does not require a lot of time. It's approximately 1 day that is required. So that is, again, quite low cost investment. But once teachers have these skills, they can practice them throughout their career. It's quite straightforward, not very complicated. So once they understand it and have the routine to do it, they can keep doing that throughout their entire career. Also help the community if they face issues with their vision. The fourth key message is related to the time required for vision screening of students. The actual time, as I mentioned earlier, only takes a few minutes per child. So both the time required for training, but also the actual testing time should not impact the teacher's teaching time negatively. And for me, that's a very important criteria because, as I've said before, you know, the core responsibility for a teacher is teaching. And they can do additional tasks, but it needs to be realistic and it needs to be feasible for them. So the last key message I'd like to share is that, and I've highlighted many times throughout the presentation, active collaboration between ministries of education and health is essential for successful implementation. We need to ensure that there is a support network of qualified eye health professionals to do these follow-up screenings and provide glasses and extra additional referrals to specialized centers. So collaboration is very important. And I think if we talk about disability inclusion in general, partnerships between, interministerial approaches are critical to mobilize all the expertise and the resources in country to support children with disabilities in the best way possible. So partnerships, but specifically in this case, Ministry of Education and Ministry of Health, but often Ministry of Social Affairs is involved because they have the responsibility for persons with disabilities, for example. They sometimes hold the budgets for assistive devices or for the distribution of this equipment. So it's important to set up good networks and collaboration with different ministries within country. So then I would like to end my presentation with an uplifting story and from one of our beneficiaries, because that always, for me, that means that's why we do these things. It illustrates very nicely how a small intervention can have huge impact. So you may recognize this girl. Her name is Srai Liep, and she was involved in the eyeglasses project in the pilot in Cambodia in 2012. She was in the video, the introduction video about the eyeglass project. So she had problems with her eyesight and got her first pair of glasses in grade 6 through the eyeglass pilot project. For quite some time, she had struggled with seeing the blackboard, and therefore she sat in front of the classroom. So the teacher had moved her in front so that she could see it better. But still, her eyes would hurt most of the time, and studying took a lot of extra effort. So she was very frustrated. But when she received a pair of glasses, she was so happy that she could sit anywhere in the classroom and she could still see the blackboard clearly. So that gave her a lot more freedom to sit with her friends and blend in with other students a bit more easily. And she really likes to study and is full of ambition, as you have seen in the video. So she wants to go to university and become a lawyer. She's now studying in grade 11. So when we first met her in 2012, she was in grade 6. And she managed to successfully pass 2 critical transition points in education. The transition from primary to lower secondary, and now from lower secondary to upper secondary. So it's often during these transition points that students drop out, especially girls, unfortunately, still. So there are obviously many different factors responsible for Liep's success in participation in education. But in her own words, her glasses helped her to see much better and stopped her eyes from hurting. And that made studying a lot easier and a lot more fun for her. So this is just to illustrate that a small investment like a pair of glasses for Liep has given her the joy to learn, to participate in education actively, and hopefully has encouraged her to keep up with her ambition and stimulate her ambition to become a lawyer and to continue her education. So with that, we have come to the end of the presentation. And I thank you for all your attention. I'm looking forward to questions because we were hoping to have a dialogue and answer the questions or concerns you may have about my presentation, or any questions about vision screening programs or maybe initiatives in your country. So I hope that, Jennifer, you have managed and monitored the chat box. Are there any questions yet?
Yes, thank you so much.
Go back to Jennifer.
Yeah, can you hear me, Elizabeth?
Yeah.
Can you hear me?
I'll close sharing my screen.
Can you hear me?
I can hear you, yes.
Okay, great. Thank you so much, Elizabeth. This has been very detailed, very informative. You went into a lot of details also with regard to the framework, which is great because it really related back to the course content. Also in terms of what we're trying to achieve in module 3, looking at issues of sustainability, affordability, desirability, and so forth. So you made that very relevant. Providing a case study to highlight these issues for the participants. So I thought that was great. We are running over time, I have to say. We are now 3:10. We'll be trying to get some questions in, and we'll start in a minute. I just wanted to make another comment about Sray.
Yeah.
It's actually very nice to hear you say that, because I know that a lot of participants felt very bad when they watched the video, because in our video, Shrey actually drops out of school.
Oh, that's the other Shrey. Yeah, of course. Yeah.
And your real world Shrey story, she actually is a success story, which is great. So I think it's quite nice to see that contrast from the beginning of the course, where we showed the effects, the negative effects of not having been screened, and you provide us with a positive example. So that's
Good.
great. Yeah.
Yeah, we need those successes, right?
Exactly. And I like the fact that this comes up in module 3, because we're ending on a positive note for
exactly. Yeah, with the right
issue.
interventions, we can keep them in school. Yeah.
Exactly.
Yeah.
So there are a lot of interesting questions that came in.
Good.
Let's see that we spend about 15 minutes on the questions, and then I would suggest that any other questions we send over to you, so that you can perhaps kindly respond to those in writing, if you don't mind.
No, not
Liz?
at all. No,
That's
I'm happy
great.
to do that.
Okay, let me straight go into some of the questions. I mean, there is Ramachandra from India. I mean, the comment he's making is that by and large, teachers are already burdened with many other related and important aspects. So basically, what he's wondering is whether any negotiations required to be done with ministry officials. Because in many countries, teachers are added on many responsibilities, and that affects teachers' time to support learning in the classroom. And how is this addressed?
Very good question. I'm glad that comes up, because as I said during the presentation, it's been my concern and is still a concern anytime we negotiate to have teachers tasked with these kind of interventions. It's additional interventions or activities that they need to do on top of their already heavy workload. And I do recognize also, for example, the impact of COVID, all the adjustments they have had to make, there is a limit to what we can task teachers with. So we really have to make sure that we provide the right support to support them, and to make sure that this is feasible for them. But I think this is something that needs to be discussed at local level, to see the situation and assess, for example, who is the right person in the school who can take on these basic vision screening activities. Maybe it could be the librarian who does not full-time have children in the classroom, so he or she can be participating in the training and take on that as a focal point within the school, to do that when there are no students in the library, for example. Or there might be a school health nurse already in the system appointed that could take on this. So it's not necessary that it should be the classroom teacher necessarily, but it's more the idea that using the school as a platform for extending out these services to children that otherwise don't have access to these services, right? It's like, how can we bring health services to these children? Because they obviously don't have easy access to them. So finding ways to help and utilize the school network where these children already are, they don't have to make any extra effort to get there, to make sure that we then facilitate access to these services. But there could be different modalities. So it's important to look at the local context. And I agree that if teachers already have a very heavy workload, it needs to be discussed how this can be facilitated, whether they can be freed, or if there are other people with less teaching obligations to take that task instead.
Great. I actually have a follow-up question that comes from Lalita from Uttar Pradesh, because she's wondering, from the teacher's perspective, have they resented the idea during the pilot? Were they interviewed in terms of their involvement? What has been some of the feedback from the teachers who were directly involved?
Very good question too, because obviously they need to be motivated, right? If this is forced upon them, then the collaboration is probably not so high. I think we had different lessons learned there. First of all, we asked 2 volunteers per school. So schools usually has 5 to 10 teachers, for example. So we asked who wanted to be the focal point to be trained, and we managed to find 2 volunteers in each school. So that was quite easy. And teachers seemed to be interested in it when they came to the training. So I didn't get the impression they were forced to volunteer. That could be a risk, obviously. The fact that we offered them with free screening and free glasses during training, for example, was a great motivator and a great incentive. and feedback from teachers who had gone through the training and then went back to their schools to be the community focal point for vision screening. They really felt empowered, and I was surprised by how keen they were on actually extending these services to community members. And there were community members coming to the school saying, I can't see very well, and I hear you do this vision screening. Can you do that for me too? And so they also gained some status and some respect in the village or in their own communities, that they had these skills and that they could actually serve and help community members when their time allowed. So that was an interesting positive spin-off again. So they needed some initial encouragement because, as I said in the presentation, some are very hesitant, like I'm not an expert in these things and I can't do this. And I feel uncomfortable testing children's eyes. But once they learned how it worked and actually how easy it is, and that you don't need to be afraid, and if there's any complicated situation, then there will be the referral network and the support system behind you that can guide you through this, and that can take over the more difficult cases or complicated cases, then they felt actually quite happy and quite pleased with their newly gained skills. So I think that was very interesting to learn about.
And then there is another really interesting question from Nazir from Punjab in Pakistan, taking us back to the idea of looking at learning achievements, right? I mean, we're providing these assistive devices. Then the idea is, how did you measure the impact of this project on the learning achievements of students? To what extent was it effective?
That was something we unfortunately didn't test in detail, and that's something that was one of the disadvantages, the things we had to, during the pilot project, do this at the end of an academic year, but we provided glasses, for example, in the month before the school year ended. So you can imagine children who already struggled with their eyesight were already quite far behind, and would not necessarily have benefited from the new glasses before the decision were made whether they passed to the next level or not. So we didn't do an in-depth study there, but and unfortunately, because I would be very interested in looking in a more structured and a more systematic way on impacts on learning achievements. But the illustration of Srey, for example, about making it to grade 11 now, while she really struggled in primary school up to grade 6, is obviously like an anecdotal evidence that these children should be able to learn better with improved vision.
Great, thanks, Liz. And then there was an interesting question from Bijnu from Bhutan, from the UNICEF office. I mean, he's referring to the point that you were making, that vision screening started as an entry point in Cambodia, and that you mentioned a number of spin-offs. But he's wondering how did the project strengthen IE as a whole in the country? Because I mean, visual impairment is only one of the barriers, and one more subtle form of disability, he gives an example, such as intellectual disability, goes very often unnoticed. So it would be great to learn how the entry point of vision screening accelerated inclusive education as a whole in Cambodia.
Thanks for this question, because I'm very glad that comes up. Obviously, you know, inclusive education is a lot more than correcting vision refractive error. It's much more complicated than that, unfortunately. You know, if it all was so easy, then we wouldn't have this course, I guess. But it is very complex, and you have to start somewhere. In Cambodia, because of the prevalence study they did, they decided to start with vision screening. It could be any other situation that could allow to open a door to address inclusive education in a better way. In Cambodia, this was in 2012 when discussions about inclusion started to take more form, and but they didn't have a solid inclusive education policy, for example. So this stimulated a dialogue and initiated the dialogue about what else can we do on inclusive education if we commit ourselves to this. So there came a policy, and then there came a specific designated department within the Ministry of Education. Before that, there was no specific specialized department for special needs children, for example. So they established a separate department to give that more prominence and more authority. So then they decided to establish a new teacher training program specifically for inclusive education teachers. This is all over a time span of several years, obviously, because these things don't go very fast. But I think it is hard to say. It's very important. That's what this course is all about, obviously. Look at the local situation and where are the entry points? Where is the interest? Where is maybe some small success already that can then be highlighted to put this on the agenda and get the priority for the issue of inclusive education, and then expand, start from what went well, what worked already in the area of inclusive education, even if it is something simple like vision screening, and then expand from there. I'm not sure that addresses the full question. I fully believe that this is a very valid question, especially children with intellectual disabilities often go very undetected and don't get the support. Vision screening, hearing screening, those are the more, the easier ones to address, but there is much more expertise and skills needed within the teachers that they understand how to address other needs as well in a more effective way. And that all comes back to obviously training both pre-service and in-service. But there's a lot more that needs to be done, and I'm not sure if Daniel Mond described in module 2 about tools that UNICEF is developing on the screening and the assessment of functional difficulties. There is a teacher version that helps teachers with a systematic way of assessing functional abilities of children, so that you can already identify which areas the child may have an issue, and so that follow-up action can be taken. But also, what does that mean for your teaching? How can you adapt your teaching to address these specific needs better? So there are many different initiatives and programs ready to help and support teachers to build their capacity and to equip them with a wider range of skills and ideas pedagogically to reach out to these children and help them learn more effectively in the classroom, in a mainstream classroom. But a lot more needs to be done. That's why I'm excited to have this course, because I know that we are today together with so many like-minded people who are committed to bring this to a higher level. And we need each other, because there is a lot to be done still.
Yeah, sure. Actually, what I wanted to get back to, because you brought up Daniel Mond and the functional approach to data collection, to what extent has the screening project created stronger linkages with the education management information system in Cambodia?
It's an issue still. It's not done in a very systematic way yet. There have been improvements, but the system has not been implemented nationally yet, the school vision screening. So it's not been integrated fully into the EMIS system yet. And I think, again, collaboration with partners in the Ministry of Health is, for example, important too, so that these databases are linked somehow, and that data available in one system can also be accessed to another system, because that can help also to get a better understanding of the situation. But there's definitely room for improvement, and that needs to be considered too in each country. Yeah, because that's also still being developed, right? EMIS systems are still being set up, and it has obviously a lot of potential of expanding to make it more disability responsive. But that is still also something very new for most countries. So there's a lot more that needs to be done, investments that need to be made, capacity that needs to be built to help ministries to do that effectively. Yeah.
Thank you. I mean, that was related to module 2. Now, with regard to module 1, Nazir from Punjab again asked an interesting question. He was wondering, why did Cambodia create a special education department, and why didn't they call it inclusive education department, for example? Or why wasn't it part of general school education department? So how does Cambodia define special education? Because I mean, the risk of calling something special education may be that you fall back into a segregated system, right? Because I mean, special education is typically referred to as a special environment for children. So that's, I think, where Nazi is coming from with his question.
I'm with you on that one. So I'm glad you bring that up, because I think it doesn't help to call it special education, because it sounds like separating it again. And we just want to move away from that, an integrated, holistic approach to education, where all children can learn regardless of their functional difficulties or not, right? So it needs to all be brought back to a mainstream system where everybody is supported in their own way and regarding their own needs. So yeah, it's more historic that they called it special education department, and then they were very reluctant to change it into inclusive education, although they acknowledged that it wasn't maybe the best decision or the best label that they could give it. The idea behind it was good, obviously, that it should have a department with specific expertise to support teachers in becoming more inclusive in their approach. But they were still very stuck with the name on special education, and that is the same, the special education department or the special education institute that now prepares courses for teachers to become more inclusive. The same thing, it is also called inclusive special education, which, yeah, I fully agree. It is much better to call it inclusive, because that means that it's part of the mainstream and not separate and special. So that is still, I think, yeah, it's more historic and then difficult to make those changes, because the department and the institute had just been established. So they're reluctant to go to another name change. But I think hopefully in the future, they will reconsider that. Obviously, they have a policy for inclusive education and not special education. So there will be, behind the scenes, I'm sure there is still a lot of discussion about that.
Yeah, because it's a question of policy coherence, right?
Yeah, exactly. Yeah. And they do fully embrace the idea of inclusive education. So labeling it special education is kind of going backwards. So you picked it up. I can't remember who asked the question.
Nasir, yeah.
Well, yeah. That's a very good, sharp observation. And I hope that, yeah, anywhere in the world that we don't speak about special education anymore, but talk about inclusion and fully inclusive mainstream schools, because that's what we want to see happen. So, yeah.
Okay, great. So then we have a question from Piaro from Pakistan, from the Sindh province. What will be the role of teachers and parents for developing training materials for teacher training on visual impairment in school? So he's already assuming that parents would be involved in that process, which is interesting. That
is really great. I'm really happy, because that's not something that is automatically coming up when we talk about teacher training programming, right? So that inclusion of parents, especially parents who have children with disabilities, is very important. And what we promote often is to very much include DPOs, the disability people organizations that represent certain groups, to be engaged in that process as well. So even if you can't include all parents, that you at least have spokespersons from the different disability groups represented, so that they are engaged in a participatory approach to decide on how to deliver best on the specific needs of these groups. So very good question. And I do hope that at local level, these things are taken into account, and teachers work very close with the parents of children with disabilities in their classroom, because obviously learning also does not end in the classroom. It extends into the community and at the household level as well. And often parents do not know what the capacity of their child is. They may not know how they can stimulate the development at home. So I think teachers and parents need to work very closely together. And I see a role for DPO representatives who have that understanding, because often they have lived through it themselves, or they know and work with groups who have bumped into the barriers of systems because of their different abilities. So they have a lot of expertise that they can share. Also, where help is provided, or where support is provided. So to get access to services that are existing, but parents and teachers may not know about. So it's very important, again, a participatory approach, but also those networks, partnerships, again, with as many stakeholders as possible. And I'm really happy that you brought up the parents and teachers working together, because that's very powerful at the local level, to make sure that children feel supported and they have that support network, as well as in the school as at home. Yeah. Great. I think this is a really nice way to end this very informative webinar. We have lots of positive notes during this webinar, which I think is great, because we do need success stories. So I think this is it's such a challenging time, obviously. Exactly. COVID on top of everything else we
Yeah.
already have as challenges in the education system, and advocating for inclusion and working towards that, that we need successes to keep each other going, right? So, and this is, I think, you know, the course that IAP is offering helps also to bring us together and motivate each other and have an opportunity to just share and exchange, so that we stimulate and motivate each other and keep each other.
I couldn't agree more.
There are so many good things happening everywhere, but often we get so swamped in all the things and the demands and the difficulties and challenges we face, that it's good to step back a little bit and celebrate successes as well.
There are a couple of more questions that came in that we will be forwarding to you, so it would be great if you could answer those. So thanks again for being available, Liz.
Yes,
really great
thanks
webinar.
Thanks for everybody who waited, who were keen to start, and then we were not there yet. So.
Exactly. I wanted to end with this webinar with a few things that are course related, if you don't mind, Liz.
No, not at all.
I just wanted to remind everybody that it's important that you start completing the outstanding activities in case you didn't get a chance to complete those for modules 1 and modules 2 and potentially also the pre-phase. That's going to be important. We're going to send out a message soon to check with you what name you would like to have on your certificate, to make sure the spelling is right and the right order of your names is on the certificate. So I just wanted to make sure, while mentioning that you know, you make sure that you complete all the activities. And I also wanted to remind you of our last webinar. That's going to be really interesting, because it's going to present the mapping study that UNICEF has been supporting. The regional office of UNICEF has been supporting a mapping study of inclusive education, and we do have the lead consultant who will be presenting the findings, and the report is just about to be finalized. So this is really fresh off the press, so to speak. So that will be quite interesting for all of you to follow, to see what kind of initiatives were able to be gathered as part of that mapping study. And I think would be an interesting discussion to see to what extent you are aware or not aware of perhaps some of these initiatives, and can exchange with other participants from other countries on particular initiatives within the region, because that's also the aim of this course, is to build networks, to facilitate for you to reach out to other countries on some of the initiatives that you may be interested in. So I think this is where UNICEF and IAP play a huge role in facilitating that. And I hope we do this. So just as a reminder, that's the webinar that is coming up on the 1st of December. Okay, so thanks again, Liz. Thanks to everybody.
Very much, everybody.
Apologies again for the slight delay, but I hope it was worth it. And we'll see you soon on the platform during the next webinar. Bye-bye, everybody.
Thanks.